Did you know that more and more people are nearsighted these days? Many of those are kids, and some studies show that kids need glasses at an earlier age. One reason is many times that nearsighted people will have nearsighted kids. But what about all these electronics we're using that our kids are glued to all the time? That's also straining our eyes and keeping people inside. Well, Dr. Michael Orozco is here as an optometrist, and you have seen what these studies show, I guess, that more and more kids are coming in nearsighted.
Yeah, that's true. Definitely increase in nearsightedness over the past 20 years or so.
And there's a lot of, I guess, theories about why this is happening, but there's a couple of potential causes that are shown to be pretty strong.
Right. Well, there's a study that came out at the end of last year that showed a definite connection between exposure to more sunlight. Kids that spend more time outside, less likely for their nearsightedness to get worse. But there are some hypotheses as to how that mechanism works, but we don't know that just yet.
So all our kids who are, afraid to go outside or complaining they want to sit on their cell phone inside, that actually could cause more nearsightedness than their neighbor who's outside playing.
Yeah, especially for folks, for kids who have two parents that are nearsighted, it's especially important that they spend time outside.
What age should kids definitely come in for screening? When, parents come to you and say, I don't know, what should I do with my kid?
Right.
What do you tell them?
Well, pediatricians do a good job of screening kids to about a 20/40 level of vision, but really a thorough comprehensive eye exam with dilation should be done when they're around 4 years old and they're getting ready to start preschool. That's the ideal time to start checking.
And as we look at all the screens, a lot of parents used to say, sit away from the TV, you're sitting too close. Get away from the phone, you're sitting too close. What do you tell people?
Yeah. Well, sometimes the reason the child is sitting close to the television is because they can't see it if they sit back, because they're nearsighted. But generally, we want to recommend a comfortable, with their fold to the arm, comfortable distance, whether it's on their laptop or whether it's on their iPad or their phone. But as with adults, the key is in moderation, not to spend hours and hours and hours without taking a break and doing something different.
And are they more nearsighted when they come in, or is there any other metric that you can use to study people? Has changed over the years with all the stuff we're using?
Well, there's various methods to measure how much nearsightedness there is. The key is, getting them checked early so that we can take care of their vision at an earlier age, and then, of course, monitor them. And
you have a practice here, and where is that?
Right, Medical Center Ophthalmology Associates. We have a group of 12 doctors consisting of optometrists and ophthalmologists. We have from pediatric specialists to retina specialists, cataract, everything in between, dry eyes.
Even stuff for old people like Delane and I.
We say from birth to the grave, we can cover it all.
All right, well, thank you very much, Dr. Michael Orozco. Delane?